The way I would talk to a patient, I would just remember the way he would talk to a patient. So it's not about your privilege, it's about your mindset. It's about the ethics.
This feels very personal yet powerful. Be the change,
Yes,
right? So that's
yes.
the clinic name.
Yes.
Can you give us some brief why Be the Change?
By seeing our brand name, if you can see our intention or what we intend to do, then we are successful.
You introduced Gujarat's first Accure Laser treatment.
Right.
Can you give us some brief about how does this happen?
We recently took out the data of almost 25,000 patients past 4 years. 60% were females and 40% were males.
Nowadays, I feel that the Gen Z and the new generation
Yes.
is also taking care of their skin very well.
Absolutely. Since the time we have started, there has been just one therapist who has left us. Now we have added an entire segment of wellness.
Wow.
We have added an entire segment of longevity.
Saying yes to influencer collaboration.
It's somewhere in between glow up and grow up.
ઓફકોર્સ ધંધો ગુજરાતના ખૂનમાં છે, પણ આ ખૂનમાં તમારા એથિક્સ, તમારી ઓનેસ્ટી હોવી એ પણ એટલી જ જરૂરી છે. સ્કિન કેર, ડેન્ટલ, આ બધી ફિલ્ડ એવી છે કે જેની અંદર ઇફ વી ટ્રાય ટુ લુક એટ ROI, ઇફ વી ટ્રાય ટુ લુક એટ કે પેશન્ટ જે આવ્યું છે કદાચ 2 પીડા વધારે ભોગવે પણ આપણે 4 ચેકઅપ વધારે કરાવડાવો, એના બદલે એમને સાચી સલાહ અને સાચી ટ્રીટમેન્ટ આપવી અને એ જ તમારા ધંધાનું મૂળ બની રહે, એ જ તમારી સફળતાનું રાજ બની રહે, એ વાત અમે આજે ડૉક્ટર બંસરી મહાદેવિયા સાથે કરી. ડૉક્ટર બંસરી મહાદેવિયા ઇઝ અ ગોલ્ડ મેડાલિસ્ટ. She is also one of the trustee in Ahmedabad Dental College. She runs her own clinic by the name of BeTheChange. There is a beautiful story behind BeTheChange as well, which we discussed on the Gujpreneur. I think there are no more words for her. Let's hear more from herself.
Hi, Meet. How are you?
Ekdam jodar. Can you just give a small brief about you, how you did your schooling, the college, and how you started the clinic?
Sure.
Your journey.
So, I did my schooling from Udgam.
Right.
It was a very, very disciplined school. And then got my MBBS admission in VS Hospital.
Okay.
VS પછી MD બી ત્યાં જ કર્યું.
Okay.
So in dermatology, skin aesthetics.
Okay.
And did a few fellowships, trained under few people just to realize what to do and also what not to do.
Okay.
Right?
That's more important, I think, what not to do.
Absolutely, absolutely. And then I realized one fine day that no, I want to do it my way.
Okay.
And that's how we started the clinic.
Okay.
Yes.
So, while સ્કૂલમાં તમે ભણતા હો ત્યારે બીજાને જોયા હોય અને ઘરમાં એક વાતાવરણ હોય ધંધાનું, does this also put a lot of impact કે હું મારું ક્લિનિક કરીશ કે મને આ રીતે સર્વિસીસ કરવી છે, or does it help, does it not help, how is that mind process works?
Yes, so it helps a lot. I think it is 80 to 90% the environment that we grew up in, and in our times it was more at home than outside.
True.
Like હવે તો બધું બહુ બદલાઈ ગયું છે, but
Right.
like always surrounded either by parents, siblings or grandparents. So એનો impact is huge, right? And I have come from a family of professionals.
Right.
Even though my father is into corporate, but at heart he is a pure professional.
Right.
Because he's a dentist basically.
Right.
So that's how he operates, and that's how my grandfather was. It's always been about values, ethics, family. So it has impacted me a lot in the way I today do my practice. Even though my grandfather is not with us anymore, the way I would talk to a patient, I would just remember the way he would talk to a patient.
Wow.
And that's why sometimes I like my like કોઈ બી સારું achievement મળ્યું હોય, and if I call my father, like he'll usually be someone કે ચલો, and if I talk to him about numbers, he doesn't like it. And then if supposing I tell him ke koi ke someone said ke yaar aa doctor par bharoso karay, he is so happy, he acts like as if I won an Oscar. Right now then I tell him, no but dad, I don't think I can give myself this credit, because probably like thodu privilege છે મને કે હું I don't have to think about money. And then he just asks me one thing, what privilege did your grandfather have? But he still practiced the same way.
True.
So it's not about your privilege, it's about your mindset. It's about the ethics, and that comes a lot from your family background. So if you ask me, it is the most important thing, the way you've been brought up.
You said very beautiful thing, even though having the privilege, keeping this ethics is very important, because
Yes.
I think there are a lot of people who are born with the privilege, but then they would be also going into આનાથી મોટું શું કે ઓકે આ છે તો હવે હું આને 10 ગણું કેવી રીતે કરું, અને that's where in the field like this people would be killing the ethics for sure.
Absolutely,
એટલે
absolutely.
પોતાનું વધારે promotion or anything, I mean not to extend to anything, but that harms to the normal patients as well.
Yes, yes.
Okay, while did you already knew કે I mean did you already know કે જ્યારે તમે કોલેજમાં હતા ત્યારે કે હું સ્કિનમાં જઈશ or ડેન્ટલમાં જઈશ or એવું how એ કેવી રીતે આવે?
So I'll tell you, it comes with a lot of communication
Okay.
with people who are much more experienced than you are,
Okay.
and taking their inputs, right? તમે એ જ્યારે પેલું Gen Z phase માં હો ને ત્યારે you always believe that you are right,
Yeah.
but sometimes many times you need to believe that you might not be right, and then you take, because nothing beats experience, right?
True.
You are in that phase, but you are in the limited phase. But when you're talking with someone with a lot of, and I'm not even saying just someone who's elder than you, I'm saying someone who's more experienced than you. There's a big difference. કોઈ લોકોએ 20 વર્ષ લાઈફના કાઢી નાખ્યા, પણ કેવી રીતે કાઢ્યા, and it's not even necessary કે એ 20 વર્ષમાં એ માણસ બહુ કઈ હજારો કરોડો બનાવતો એ બી જરૂર નથી. What kind of life is that person living? Is he happy or not? Is he doing it in the right manner or not? And when you talk to such people and you take their inputs based on that, so there was a lot of my internal thinking and external probably validation to a certain point. Knowing who you are as a person,
Right.
like, is extremely important.
True.
And then aligning your work with the person that you are, because only that is going to sustain, and whatever profession you choose has to sustain. Only if you sustain, you will eventually reach somewhere.
True.
Right? So for the long term sustainability, long term passion, long term honesty, like you mentioned કે એકદમ જલ્દી કરી નાખો, if you don't have that satisfaction, then you are going to keep thinking na હવે હું 10 ગણું કરું, 20 ગણું કરું, 100 ગણું કરું, right? So like when I started with my first clinic, even though my father could have given me anything, it was just with one person. It was just in a small setup, because I didn't want the overheads on me. I didn't want કે હું એ મારું સ્ટ્રેસ કોઈ પેશન્ટ પર ટ્રાન્સફર કરું, right? તમારે કરાવવું હોય તો કરાવો, ના કરાવવું હોય તો ના કરો, but my intention has to be in the intention of the patient.
Right.
And whichever privilege you come from, right, you're coming from a very low background, from a very high background, તમારા પર સ્ટ્રેસ આવે ને ત્યારે આખી સિચ્યુએશન ચેન્જ થઈ
અને
જાય.
અને એ ઇમ્પેક્ટ છે ને આઈ થિંક વર્ક ઉપર બહુ ઇઝીલી દેખાઈ જતું હોય,
Easily.
રિઝલ્ટ ઉપર તો આવી જ જાય છે,
આવી જ જાય છે.
be it any profession, I feel.
Absolutely. So you have to be very conscious and self-aware કે હું મારા પર કેટલું સ્ટ્રેસ રાખું કે હું બીજા પર ટ્રાન્સફર ના કરું.
True.
Right? And especially in professionals, ethical professions like a doctor, where you're dealing with human lives, it is extremely important.
Very beautiful two things you said. One is અનુભવ and second is the vision.
Yes.
કે 20 વર્ષથી કોઈ માણસ કંઈક એક પ્રેક્ટિસ કરી રહ્યું છે અને એ અનુભવ તમને એટલો ઇઝીલી મળે છે એમના પાસેથી, તો વી શુડ ઓફકોર્સ ટેક ધેટ એડવાન્ટેજ. અને with the kind of vision you have started, we would also love to understand, this feels very personal yet powerful, BeTheChange.
Yes.
Right? So that's the clinic name.
Yes.
Can you give us some brief why BeTheChange અને શું વિચારીને તમે આ નામ કર્યું?
Wow, so that's, I think, my favorite question.
Right.
Because I had seen a very beautiful TED talk by Simon Sinek,
Okay.
which he explains all the most I will not say powerful, but most impactful brands start with 3 basic foundations, right? Which is why do you do what you do, how do you do what you do, and what do you do, right? So એમાં જે why છે ને extremely important. ઘણી વખત the why is not properly conceptualized in your head when you start something. I feel that till you get that why clear, don't start it. So it was never, for me, it was never about just changing the skin, because that is superficial, although the problems are internal.
True.
Right? So I always feel if you change your internal health, mental health, and your skin, you don't just change skin, but you change lives.
Yeah.
So I genuinely want to change lives through the confidence, through the skin, right? So that's why there is no skin in my name. It's
Yeah.
BeTheChange. and we launched it on 2nd of October,
Okay.
which was Mahatma Gandhi's
Right.
vision, be the change that you want to see in the world.
World.
And actually, there is nothing to do with the skin. If you see Apple, you see Nike, Apple doesn't sell કે અમારું આ લેપટોપ સૌથી બેસ્ટ છે, અમારું આ સે આઈફોન સૌથી બેસ્ટ છે, વોચ સૌથી બેસ્ટ છે. What was its tagline? The people who are crazy enough to think, think that they can change the world are the ones who do.
Yeah.
So what does it tell you? Are you crazy enough? You're welcome here. Right? It sells crazy. It sells innovation. What does Nike do? Nike doesn't sell તમે ક્યારે નહીં કઈ એક શૂ નહીં કે એક ટી-શર્ટ નહીં
એની વાત નહીં કરે. Yeah.
Nike sells athletics.
Yeah.
It sells the never say die spirit. It sells just do it. Right?
Perfect.
It sells something which is very deep, which is very internal. So in skin, actually, when in this profession, it changes the way when their skin changes, it completely changes their confidence.
True.
And that is very powerful and very, very satisfying. So it comes from internal to the external. Yeah.
A very powerful statement you said. It's not just powerful, but it is also very impactful as well.
Absolutely.
કારણ કે with starting any business or starting any profession with this vision also is very important. Were there any key important points કે જે તમે early જ્યારે તમે કોઈની સાથે પ્રેક્ટિસ કરી હશે or કોલેજમાં ભણ્યા હશો ત્યારે આ સીડ એક મુકાઈ ગયું હતું કે ઓકે I don't want to go by Dr. Bansari's clinic or that typical or the regular way. And how did this come into the picture?
So something very important for me was the intention. If by seeing our brand name, if you can see our intention or what we intend to do, then we are successful. Right? So BeTheChange was meant like that. And by intention, I mean the purity in our intentions. મને ઘણી વખત એવું થાય કે ધારો કે because see everyone's skin is different, everyone's hair is different, body is different, બીજા ઘણા factors હોય. કોઈ અહીંયાથી ગયું ક્લિનિકમાંથી ગયું saying કે મને અહીંયાથી રિઝલ્ટ ના આયા, which is possible, right? I am okay, I can sleep with that, right? If someone says કે આ ડોક્ટરે મને ખોટું લખ્યું, મને ખોટી ટ્રીટમેન્ટ સજેસ્ટ કરી, મને કેમ આવે, I can't sleep with that. So can you see the purity in my intention or not, right? When I am talking to you. And that has been from day one. Even if I talk to my friends and if somebody asks me an advice, probably with my experience I gave you some advice, maybe that might not be right for you, but did you see my intention? My intention for you was 100%. So that has been like since the day I was a kid, because I have seen that intention from people towards me. And from being in school to college to now professional, I am the same person that I was, and I am the same with, even when I'm talking today, I wish that if somebody is seeing this with that intention, or I'm practicing, I'm writing a medicine or giving a treatment, why are we giving the treatment? There has to be a why. Why are we giving that medicine, or why are we not giving the medicine? Extremely, extremely important. So a power of intention je છે ને એ સખત છે. It's too good. For example, I had like TED Talk ma, it was the secret to beauty. Right. The topic was secret to beauty. And I just showed one picture. I said, does anybody recognize this girl? I mean, she has beautiful eyes. She has, wonderful skin. She has the perfect jawline and jet black hair. Right. And nobody knew who that was. And I said, this picture did not go down in history. Right. And I changed to the next slide. That was actually Mother Teresa.
Oh.
Right? Mother Teresa, the picture that went down in history was the one which was full of wrinkles, no jawline, droopy eyes, gray hair. But that went down in history. Because when people see that picture, they see her intention towards the kids, towards mother, they see empathy, they see purity.
True.
So I always say, see, if your looks are helping you to get on that journey,
right,
then go for it. એમાં કોઈ જ ખોટું નથી.
Okay.
Right? Let it be a means to achieve the best version of yourself.
Right.
But it doesn't have to be the ultimate destination કે તમારા mental health ને એટલું affect કરી જાય કે તમે છેવટે કામ કરવાનું જ ભૂલી જાઓ.
True. છે ઘણા બધા બી હોય છે અને ઘણા બધા રોંગ પ્રેક્ટિસીસના લીધે બી ઘણાની સ્કિનના આપણે નેગેટિવ્સ બી જોયેલા હોય છે
ઘણું
એટલે
બધું
આઈ કેન નાઉ રિલેટ હાઉ મચ ડઝ ઇટ હેલ્પ કે ઓકે એ લુકથી એ તમે એમ્પેથી બતાવી શકો છો.
absolutely
વેરી ગ્રેટ.
it affects a lot, your looks affect yourself a lot.
We have always seen in your Instagram reels a lot of new instruments keep on coming, which
Yes.
is probably very rare in the city, very rare in Gujarat as well.
Yes.
And you always keep coming with the new innovation in the
Right.
industry as well, right? You introduced Gujarat's first Accure Laser treatment.
Right. Yeah.
Can you give us some brief about how does this happen and how is the response from the people
Absolutely.
who comes to you? And what is this exactly Accure Laser treatment?
So I'll tell you, whenever I go for some new technology, there's a lot of thought that goes behind it.
Right.
And again, as I mentioned, there is a purpose and why we are going in for that technology. So I saw one of the most common causes in young girls and boys also is acne. And there have even been researches where it is said that schizophrenia જેટલું mentally affect કરે છે ને, it's second number પર acne આવે છે.
શું વાત કરો છો?
Like that is how badly it affects the
Mentally.
mental framework of a person, right? Acne, and only those people who go through it actually realize what they go through when they have that acne, right? Now, and then what I saw in practice is that acne માટે એટલી બધી antibiotics prescribed થાય છે that it really messes with your gut health and really creates a lot of resistance that touch wood you should not need it in the future. But supposing if you need antibiotics in the future for an internal infection which might damage you much more, right? It might not work. That antibiotic might not work because તમે એટલી લઈ રાખ્યા છો, એટલી એન્ટીબાયોટિક્સ લઈ લીધી છે તમે. આ તો ખાલી આપણા જ કન્ટ્રીમાં હોય છે કે ચણા મમરાન છે એઝિથ્રોમાઇસિન લખી દીધું.
Yeah, true.
Right? If you go to
Foreign
abroad,
countries, it's not
you
possible.
don't get antibiotics because it totally messes with your gut health and that leads to other issues. It causes a lot of resistance, right? So, and see, even the results, see, if you're taking an antibiotic and you're getting a permanent result, then also one time taking it is worth it if it's going to help you mentally that much.
Okay.
But it is not going to give you a permanent result, right? So you have to do something which is not going to cause you side effect, which is going to give you a similar, same or better result and not affect you in the long term, right? So these technologies like Accure, and we have something called the blue light, they are the technologies which are external. They
Okay.
don't have any side effect and they can reduce acne almost 30-40%,
Okay.
in 1 to 2 sessions.
Okay.
So that is the long term vision of this, without popping any pill, without any antibiotics. And trust me, since the time I have started my practice, 4 વર્ષ થયા, I have not given a single antibiotic for acne.
Sure.
And majority of our practice is acne, right? So I mean, that's the truth. Nobody talks about it, but that's the truth. કે એન્ટીબાયોટિક્સ એક્નેમાં જરૂર જ નથી, તો શું સોલ્યુશન તો તમારે આપવું પડે ને. So then these technologies, science, innovation is the answer.
Wow. So I think you are not just doctor of skin. You are going into the psychiatric thing.
Absolutely.
This is affecting a lot on mental health as well. અને
Absolutely.
એને સોલ્વ કરવા માટે ઓકે સ્કિનને સોલ્વ કરવાની જરૂર છે તો then I'll get it done.
Yes.
અને then I think now I resonate BeTheChange word
Yes,
very well.
absolutely.
કે એકને છે તો પેચ લગાવી દીધું કે આ છે તો આ દવા આપી દીધી, that's not the solution.
Yeah.
અને that change is something now I can feel the sense of it.
Yes. Yes.
Great. Okay, how do you ensure when the client comes, patient comes, અને પ્રોબ્લેમ્સ લઈને આવ્યા હોય, ઓફકોર્સ એનું ટ્રીટમેન્ટથી સોલ્યુશન હોય, બટ દે બીન ઓલ્સો બીન ટેકન કેર એઝ અ પર્સનલ કેર, કારણ કે ઘણીવાર એવું હોય કે લોકોને એ મેન્ટલ ટ્રોમા બી હોય કે યાર મને આટલા વર્ષોથી છે. ઘણીવાર બ્રાઇડ્સની એજની ફિમેલ્સ આવતી હોય કે યાર મારું આ ઇશ્યુના લીધે લગ્ન નથી થઈ રહ્યા. સો હાઉ ડુ યુ મેક શ્યોર કે દે ફીલ કમ્ફર્ટેબલ, દે ફીલ સેફ, દે ફીલ દે બીન ટ્રીટેડ વેલ?
So first and foremost is don't judge, right? Because you are just sitting with them for since 10 minutes, half an hour, 1 hour, right? But you don't know what background they are coming from, what upbringing they are coming from, what have they gone through mentally, right? So when they are saying it, you just accept it. You don't judge it. તો હવે એ પ્રોબ્લેમ છે, ઓકે એ પ્રોબ્લેમ છે, સાચો છે ખોટો છે નથી પડવાનો, પણ પ્રોબ્લેમ છે તો જ કોઈ આવ્યું છે ને આટલું ટાઈમ લઈને તમારા પાસે, રાઈટ? સો ધેટ વી ફર્સ્ટ એક્સેપ્ટ ઇટ. Secondly, then we try to talk, communicate and get to the root cause. Recently only we had one patient, recurrent acne ચાલુ જ છે, આ દવાઓ લઈને થાકી ગયું. Main was actually her childhood trauma, which was making her so sensitive to the smallest issues that she was getting stressed in like the smallest issues. હવે જ્યારે તમે આટલો સ્ટ્રેસ લો ને તો it increases your blood cortisol levels, and when your blood cortisol levels increase, it's a havoc in the body, which can cause hair fall, it can cause dryness, it can cause acne. But હવે cortisol કોણ ઓછું કરશે? તમે બહારથી ખાલી ક્રીમ્સ ને ટ્રીટમેન્ટ્સ કે ઇવન ટ્રીટમેન્ટ્સ એ તમારું કોઈ પરમનન્ટ સોલ્યુશન નથી, રાઈટ? સો એ કોર્ટિસોલ રિડક્શન તમારું પરમનન્ટ સોલ્યુશન છે, રાઈટ? સો લાઇફસ્ટાઇલ ચેન્જીસ તમારા પરમનન્ટ સોલ્યુશન છે. સો ઇટ્સ મેઇનલી કમ્સ થ્રુ અ લોટ ઓફ કમ્યુનિકેશન વિધાઉટ એની ફીલિંગ ઓફ જજમેન્ટ.
Wow. Okay. I'm seeing a lot of change in the field. જેમ લોકો સ્કિન કેર ને હેર કેરમાં આટલું બધું કરી રહ્યા છે, અને ફિમેલ જનરલી વી હેવ સીન દેટ કે ઓકે ફિમેલ સેન્ટ્રિક વધારે આ ફિલ્ડ છે. હાઉ ડુ યુ સી મેલ્સ નાઉ ટેકિંગ કેર ઓફ ધેર ઓન સ્કિન ધીસ ડેઝ, ઓર દે આર કમિંગ ફોર ધ ટ્રીટમેન્ટ્સ? કે પહેલાં એવું હતું કે આઈ થિંક માય ફાધર વુડ બી ઠીક છે તો થાય આપણને, ને આપણે તો બહાર રખડવાનું હોય તો આવી સ્કિન હોય, અને નાવ દે આર કમિંગ. હાઉ ઇઝ ધ ન્યૂ જનરેશન, ઓર યુ વુડ સે મિલેનિયલ્સ, ટેકિંગ કેર ઓફ ધ સ્કિન, એન્ડ how is this changes there?
There is a lot of change. કારણ કે females, like for example in our parents generation, એમાં દેખાય છે કે males are little less careful than like my father would be less careful than my mother, right? But હવેની જે generation છે ને એમાં there is not much difference, to be very honest, and why should there be? It is the same thing, because in this you are dealing with your confidence, it's nothing else, it's dealing with confidence. So male no bhi confidence છે ને female no bhi confidence છે. We recently took out the data of almost 25,000 patients past 4 years ma. 60% were females and 40% were males.
શું વાત કરો?
So now in the next 10 years you can imagine a 50-50 થઈ જ જવાનું છે, right? So males are also extremely careful about the way they look, they age, they don't like it, and why would they, you know? So એમાં કોઈ મને પેલું લાગતું જ નથી, like this is what we saw coming.
Yeah, because we are seeing that. But કદાચ આપણા father would be, they would be being shy to go to such places.
So yeah, they
મારે સ્કિન ક્લિનિકમાં જવાનું, this is the, maybe I would say it's a ego also, or maybe they would be like not taking care also.
It is little ego, definitely. And then you know what I've seen so many times ke pachi, then even eventually when they come because their daughter or
they would be pushing
I've seen that ke son doesn't push, daughter pushes ke mari dikri મને મોકલી છે, હા મારે તો આવું જ નહોતું. And then if you talk to them na એમને તો આવું તું,
અંદરથી હોય પણ એમને અટકતું હોય.
પણ હવે કોઈકની પેલી push આવે which is like either a wife, and you see there is either a female push, wife હોય કા તો daughter હોય. And so many times I've seen કે consultation માં બી બેઠા હોય, they are not able to accept કે મને આ ચેન્જ હોય છે. મારી વાઈફ ને એવું લાગે છે કે આ wrinkle દેખાય છે, મારી વાઈફ ને લાગે છે કે pigmentation, પણ તમને શું લાગે છે, which is okay. And even I even don't judge that, because males are brought up in a different way. They have a different hormone pattern. The testosterone and estrogen level in males is very different from that in females. Male નું cancellation કરો ને 5 મિનિટમાં પૂરું થઈ
પતી જાય. To the core આવી ગયા.
To the core, I have this issue, and that's when I realized that physiologically males and females are built very different. Right? And that's why, like you see, stress or acne males માં થતા હોય ને, it's usually because of their testosterone, bad eating habits, bad lifestyle, or the age, or excess sebum secretion. Females માં it's stress, you know, alag jatno stress, because females are wired, they are more emotional, they have more emotional requirement, and probably somewhere that requirement is not met. Males માં એટલું નથી જોયું. So physiologically they are very different, but eventually the need to be a confident human being, I think, is equal in male and female.
See, because I think lot of ads has also made this sense કે પહેલા આપણે જોતા હતા કે પોન્ડ્સની એડ આવે તો ફિમેલ જ દેખાતી હતી, અને they will talk about કે ઓકે ફેર એન્ડ લવલી ઓર ગ્લો એન્ડ લવલી હવે કર્યું, પણ યુ નો એ ફિમેલ જ સેન્ટ્રિક એડ્સ બનતી હતી કે ક્રીમ ઓર બોડી લોશન ને ક્યારેય મેલ સેન્ટ્રિક બતાવી જ ન હતી. એટલે જેમ પહેલાના જમાનામાં પેલું પોલીસનું એક મૂવીમાં આવતું હતું ને કે ઓકે ક્રાઇમ પતી ગયો છે પછી પોલીસ આવી, તો એ એક દિમાગમાં ચોંટી ગયેલું હોય કે પોલીસ આવું છે. તો ધ સેમ વે, yeah, same way Ponds है or the any of the good brands always have shown the female centric ads, અને ત્યાં એવું લાગે કે યાર હવે આ થોડી આપણે લગાવવાનું હોય. અને that's where when wedding comes અને પેલા કહે કે ઓકે મેલને બી આ થોડુંક આપણે ટચઅપ કરીશું, ત્યારે આપણે કરવાનું હશે કે લાઈફમાં પહેલી ને છેલ્લી વાર. ધીસ ઇઝ વોટ આઈ હેવ ઓલ્સો હર્ડ ફ્રોમ લોટ ઓફ પીપલ કે ઓકે આપણે કે રોજ લગાવવાની જરૂર નથી. But nowadays I feel that the Gen Z and the new generation is also taking care of their skin very well.
Absolutely.
Be it the hydration part, be it the stress part, but they are more aware about this. Since this is the generation where you are also dealing with them through the being trustee of the college and the university, how do you balance the clinic, the motherhood, the trustee of the university? How do you balance this all?
So it's, I think, mainly time management, lot of clarity of what you want your priorities to be. Say for right now, my first priority, of course, is to be a mother,
Right.
a good mother, because એ તમે પેલા 10 વર્ષ ના કરો ને તો એના પછીનો સ્ટ્રેસ બહુ અલગ છે.
Yeah, I'm sure.
So like I feel I have reduced my timings by 1 to 2 hours.
Okay.
And I will make sure that I go to drop him, pick him, spend 1 hour with him, and then start my practice, right?
Wow.
Which first I used to start from 10 and finish at 7:30, right? હવે એનું મેં 12 to 6 કર્યું છે હમણાં, which is okay. And I have come to terms with that, because when after 2 years when he'll become very busy, I'll again go back to 10 to 6.
Yeah.
But I have to get equal amount of pleasure from that also.
True.
And also from my work. So I cannot stop working, and I would never advise someone to ever stop working, but just a control in the number of hours and spending good quality time over just quantity time. Because I've seen, જે લોકો કઈ જ નથી કરતા, and if they are કઈ નથી કરતા, I mean being a
homemaking is also true.
Trust me, it's more difficult than being a working parent. It's much more difficult, because it's very difficult to keep your mental sanity, and you want to develop yourself into a personality that even your kid can look up to, right?
True.
So it's not like you are just neglecting the kid, right? But you are even working on yourself. When you are happy, you will keep your kid happy.
True.
And if you're only going to be in one place all the time, 24/7, just having one kind of vision and few kind of people around you, your vision also will be very limited, no?
True.
So the impact that you can create on your kid, the example that you can create for your kid also will be very different. So again, I don't think it's the right thing to do કે મેં 24/7 બહાર જ હોઉં અને કિડને બિલકુલ ના જોઉં. પણ એ બેલેન્સ કે ના, સવારના 3 કલાક, સાંજના 3 કલાક, અને વચ્ચેના
થોડો ટાઈમ
6 કલાક તમે કામ કર્યું. સવારનું એ જે છે, ના, it's only for the kid. સાંજનું 2 કલાક, it's only for the kid. Managing the kids' timings, making them sleep early.
That's also very important, I think.
So then you get a little bit of your social life.
Yeah,
Saturday,
true.
Sunday, पर थोड़ा Sunday rather, then you focus on other things. So I think setting
Balancing
your
this is
priorities
important,
right, not stopping your work, but reducing at that time. કારણ કે એક બહુ મોટા થવાના છે.
Yeah, એટલું મોટી જર્નીમાં I think prioritizing is more important. અને એ કદાચ વર્ષ બે વર્ષ થોડોક બિઝનેસ એક્સપાન્ડ કદાચ ના થયો, ઓર કદાચ જે કરવા જઈ રહ્યા છો, પણ એની સામે
તમને મળ્યું ને,
બીજું ઘણું
you
બધું
got a
મળે.
wonderful bond,
Yeah.
and I think that brings so much happiness.
True.
And also, like, I mean, I cannot give enough credit to the support system.
Yeah, I'm sure.
એટલે એ સિસ્ટમ તમારા પાસે ના હોય ને તો you are
It is very
gone.
difficult. True.
Yeah.
What's your honest advice to young professionals who would, especially women's, who would want to enter aesthetic medicine and start their own clinic?
So see, I will definitely say that it's a great branch to be in,
Okay.
because it gives a lot of flexibility in your timings also. Women, whatever said and done, eventually you have to be the one to carry the baby, you have to be the one to feed the baby. એટલે એ તમે 2-3 વર્ષ sabbatical આવવાનું છે. So that is, it's a very great branch because it gives you flexibility of timings. But I would genuinely say that let your why be clear. If you are doing aesthetics, let your why are you doing aesthetics, how are you going to do it, and what are you going to do. Emma, like we mentioned earlier, please don't become commercial, right? કારણ કે aesthetics તો હવે એવું થઈ ગયું છે ને કે every Tom, Dick and not everybody is doing well. You feel કે ના, એમાં તો there is lot of money and there is lot of fame and there is lot of glamour. It's not that. If you don't go through the right path, you're not going to sustain, right?
True.
So, and to go to the right path is basically your honesty, ethics, and purity of intention. And also then comes, if you are going to look at the intention, then you'll make sure that you will get the best technologies.
True.
And how are you going to face your patient knowing that, okay, I don't have the right machine?
Hmm.
એટલે હવે એ ટેકનોલોજી બી એટલી જ ઇમ્પોર્ટન્ટ છે, પણ based on this foundation. So if you're doing it first based on this foundation, then get your right technical know-how, and then implement, get the right mix of science, ethics, and good patient advice to build a long-term, sustainable, and reputable practice in aesthetics.
I just got the idea. I mean, not the idea, but there are a lot of brands who would be into the same kind of field, but also doing franchising.
Right.
How would one's vision go to so many outlets or so many stores or so many clinics and maintain that dignity or maintain that vision? How do you see this? Because now I can relate કે અગર તમે આ પ્રેક્ટિસ આ લેવલ પર વાત કરી રહ્યા છો, what is your take on the franchisee part of such business? And okay, this is okay, when I'm saying business, of course, it's a practice. We want to solve a lot of things to the patient who's going through something through skin or dental or hair or whatever. But then when it comes to business and when you are opening a franchisee, I feel એ વિઝન અહીંયા બેસીને તમે અમરેલીમાં કે રાજકોટમાં કે ભાવનગરમાં ખોલેલા ક્લિનિકમાં આવેલા પેશન્ટને બંસરી જે ફીલ આપે છે કે જે સમજે છે એ કેવી રીતે થાય? અને I mean, then how does this all India nation wide જે franchises run થતી હશે અને patients are also going there, what is behind it? I mean, how would patient understand, and second, how would that business also expand?
So it's a great question, and I have thought a lot about this. The first thing is having clarity in, are you a professional or are you a business person, right?
Yeah.
Now fields like these are one-to-one dealing with human life, so you are first and primary a professional.
True.
Right? I genuinely feel that તમારે પૈસા જ કમાવા હોય ને તો just put it in like mutual funds or like something like that. Why do you want to do it at the cost of a patient? And then when you are getting into so many franchisees, it's just about the money.
Yeah.
Right? And it's not even necessary that they're making money. આ તમને દેખાય છે કે કોઈ કારણે ગયું, first of all, were they happy? Are they there since 5 years, 6 years or not? It's not sustaining. પેલું બીજું કોઈ માર્કેટિંગ જોયું એ નવું પેશન્ટ જાય છે, because then to get a new customer they have to market a lot, and ultimately if you see their profit and loss, they're not really, the big chains I'm talking about,
Must be not making.
So by not making money, it's okay, but it is also a yardstick marker that you are going wrong somewhere.
Yeah.
So the only time I feel you can do this, so that's why like people keep asking me, do you want to make it? I said, if there is some city in India which genuinely needs good treatment, and if I have full confidence in a person that okay, that person has the passion,
same ability,
yes,
also
you can, is the person trainable or not? એજ ઇન્ટેન્શનથી અને એજ પેશનથી અને એજ ઓનેસ્ટીથી કામ કરવાનું હોય, then it is okay, which might take time. So I feel there is no need to rush. So be clear, what do you want? Money? Do you want reputation? Right? તમે 100 ક્લિનિક ખોલી નાખવાનું છે તો તમને reputation is gone for a toss.
True.
You are not going to be able to maintain the quality and the honesty and the ethics, because then you are working on margins and ROIs, right? Go slow and steady. You want to increase your impact, but you want to increase in the right manner, then choose the right person and choose the right city. I feel now in today's time, Bombay, Delhi is all saturated. ત્યાં તમે બીજું એક ક્લિનિક કરીને શું કરશો?
કશું ના
right?
મળે.
કંઈ ના મળે. Probably like I've seen a lot of patients coming from Gandhidham.
Yeah.
I've seen a lot of patients from Udaipur.
True.
And so if some person કાલે જ પેશન્ટ ભાવનગરથી આવ્યું હતું,
Right.
તો મને થાય કે હવે એવી કોઈ જગ્યામાં કોઈ સારું માણસ મારા પાસે આવતું હોય, I know that person, I have references of the person, I have seen the work of the person, and is going to be an ethical person, I would not mind doing something with her.
Right.
But it's not I'm going to get a private equity fund ને હું 100 ક્લિનિક ખોલી નાખું પછી એકેનું મારો personal touch બધાનું જ જતું રહે. That's why over here, Ahmedabad, it will be only 2 clinics where I can be there.
Right.
we did even try કે હું સગાઈ કરું and I can be at 3, but with the baby it was not possible for me to
Jump
go. So if
around.
I cannot go here, I will not do it. But if I get a person and the city needs it, then I would not mind doing it.
I think this is also indirectly it's a great piece of advice for people as well who would be looking into કે ઓકે હું આમાં આવીને 50 સ્ટોર કરું અને લખપતિ કરોડપતિ થઈ જવું. So if this is the intention, that this would not be the right business, I feel.
Then not at all.
Then this is purely, I think, then you just launch your product and do the distribution and retail chain.
Do something like that, ne? Do a business.
Yeah.
Then don't be a professional. Then do, and you can also be both. You can be a professional and do a business, but then keep your business a business and keep your profession a profession.
I'm sure your team doesn't need the kind of motivation speech or something જે typical business organizations ને જોઈતી હશે. કારણ કે the way you have your very set of clear vision કે okay આ રીતે આપણે જઈ રહ્યા છે. અને but still how do you manage the team at both the locations because you are someone who would be giving the right booming examples and the inspiration to the patients as well. એ ટાઈમે ટીમને છતાં બી ક્યાંક એવું થતું હશે કે ટીમ કહેશે કે ના મને નથી મજા આવતી કે આ નથી ગમતું. How do you keep them motivated or how do you keep them maintained?
True. So I'll tell you, people are everything, right? તમારાથી તો એ બધે ના પહોંચાય. So your team is everything. And if somebody really asks me, what are you most proud of? I think it is like since the time we have started, there has been just one therapist who has left us.
Okay.
Right? Baki, no aesthetic technician has left us since the time we started. અને એવું તો મને જ નહીં ને કોઈ ઇશ્યુ ના આયા.
Yeah, of course.
So issues તો ઘણા આયા હોય, but we sit down with them and it's not just about them, it's also about their families.
Yeah, true.
So how and what kind of work do you do that you not just uplift them but also uplift their family, right? And when they see that now, they will always feel કે યાર મને પૈસા તો હું બીજી જગ્યાએ મળી જઈશ તો કદાચ રેસ બી મળે, probably I'll get a better salary, I don't know, probably not, but આવી રીતે તો મારું કોઈ ધ્યાન નહીં રાખે, મારા છોકરાનું કોઈ ધ્યાન નહીં રાખે, મારી જે રિક્વાયરમેન્ટ છે કોઈ નહીં સમજે કે જે મેમ સમજી શકે છે, and because of me myself having to go through all these roles, I'm able to understand from the problems of like just a therapist coming from a very humble background to my manager or other people, the range of problems, and making each person feel that no, like my ma'am understands my problem, so it is a very basic requirement of a woman, just the fact to be feel understood, and we deal with women stuff. So if most of the times it is just ki yaar thank you ma'am for understanding, so then you have to be flexible, you have to remember you have to be very empathetic, and you have to be in their shoes without actually being in their shoes,
right?
And then giving them the right guidance, and then knowing that that they will give you, I would be able to give them the right growth as well, so they should not feel stagnated કે ચલો આજે આટલું આવડ્યું છે પણ ના હવે મારે આઈબ્રોઝ માં જવું છે, હવે મારે હેર માં જવું છે. So someone came just learning basic things, so it's basically understanding their issues, also helping them in times of need, understanding their family's issues, raising their technical skills કે આયા તારે ખાલી એમને હાઇડ્રોફેશિયલ્સ આવતા હતા પણ ગયા તારે PRP બી કરે છે, માઇક્રોબ્લેડિંગ બી કરે છે, જો લાઇન કોન્ટુરિંગ બી કરે છે, બધું કરે છે, so they feel so uplifted કે યાર અમે કેટલું શીખ્યા અહીંયાથી, and that growth doesn't stop, so giving them something which they feel that they're not going to get anywhere else.
I think this is first of very very different kind of an entrepreneur discussion we are doing, where we are not using the word called dhando, where we are not using the word called entrepreneur as well, since the intention and the vision itself is so different. I would not degrade it by saying dhando, but of course everybody has to sustain and maintain and grow it,
you have to,
right? So might be a wrong question, but how do you see BeTheChange in next 5 years?
So it's a very right question,
but I would not consider it as a dhando or business.
Yeah, it is
after our discussion for sure.
Yeah, no, that is true. So there was a conference where they invited me to talk on 2 topics. One was the technical topic, and the head of the conference, the organizing chairman, he asked me, saying, "Bansari, तेरे को इस पे बात करना है." I said, "What is the topic, sir?" I said, "One is about one MNRF technical discussion, and second is you have to say that you are getting all the high-end machines and still making money."
Yeah.
So I said, and it just struck me that, sir, I just told him, the secret to getting high-end machines and making money is not to think about money.
Yeah, sure, I'm sure.
Right? Because you cannot just keep thinking about one machine or one equipment. It's the end result at the end of the day, you know. તમે રોડ નું જોવો ચલો નીકળી ગયું તમારું પેલું બેઝિક અને થોડું ઘણું જે તમને જોઈતું હતું એ મળી ગયું. That's it.
Sustain થઈ
It's
જશે.
sustain થાય, and then you don't know what reputation and what good vibes are going into the market.
True.
And it's giving you much more growth than you thinking about the ROI every day. You know. So that is one thing where I see BeTheChange in next 5 years is now we have added a entire segment of wellness.
Wow.
We have added an entire segment of longevity. The future is about longevity.
True.
Like we talked about internal health. So and what is longevity? So longevity is not that I want to live 100 years. Right? Longevity is how many years you live? 80 years, 90 years, 70 years. You lead a good quality life.
True.
Right? Longevity is about getting to the root cause of the problem. Right? Longevity is and wellness is about understanding your skin inside out, changing your lifestyle. There are so many young girls, neck pigmentation, underarm pigmentation. The weight loss is an automatic jatu rehse.
Yeah, true.
Right? So but we want to give that solution also. So this is India's actually first center that we have, where we have a combination of aesthetic treatments. We have a combination of infrared saunas, cold plunge. We have PMF. PMF is something wonderful. It takes you into a state of meditation.
Okay.
Where it calms you down.
Okay.
We have something called the Carol bike. Is something which uses AI, to gauge your lung capacity. And that is where we use technology to get efficiency. Right? So 7 minutes માં એ તમને એવું વર્કઆઉટ કરી આપે કે તમે 50 મિનિટથી કરો ને એવું ટાઈપનું વર્કઆઉટ કરી આપે. Right? Infrared saunas છે. Right? So many girls we have seen just by doing infrared saunas, no side effect, અંદર તો કંઈ નાખતા નથી.
Yeah, true.
પણ જે પેલા mild irregular problems છે ને, irregular periods, hormonal acne, the periods are becoming regular just by this. You don't need to take hormonal pills because that has long-term side effect.
True.
So there is a big category of people today in India, especially because the competition and the stress levels and young people and social media.
True.
Saying, why didn't I achieve this? So they have put themselves in a lot of stress where they don't need medication, but they are not normal. Right? It needs intervention, but it doesn't need medication.
True.
Right? Okay, like that 20-25 irregular periods છે. તમે irregular periods હોય તો you don't have to take hormonal pills, but you have to take action. Right? So what is that action? So we want to focus on prevention. When we talk with the change and NorthStar with my sister Tulsi, we are doing the entire center. So we just have like I mentioned, all these wellness methods of doing it. Then we are focusing a lot of internal anti-aging. We look at focusing the biological age, not only your chronological age. So what is the difference? So chronological age is कि तुम्हारी birth date
your number.
Your number. Today you are say 30.
Yeah.
So that's your number. But if supposing you're smoking 20 cigarettes a day, and it's a simple blood test. Blood test करीस ने your actual age of your organs will be double. The age of your organs and your skin acute, it will give you a test. So that is your biological age. So in future, next 5 years, we look at reducing the biological age of India. It's crazy that India has actually the highest percentage of health crisis. તમે જુઓ ને, diabetes capital India છે.
Yeah.
કેન્સર હવે ઇન્ડિયા થઈ રહ્યું છે.
વધી રહ્યું છે.
બરાબર. આ બધી લાઈફસ્ટાઈલ ઇશ્યુઝ છે કે જે રૂટ કોઝ એમ મટી નથી રહી. રાઈટ? સો વી વોન્ટ ટુ ચેન્જ યોર સ્કિન, બટ વી વોન્ટ ટુ ચેન્જ યોર લાઈફ.
Great. I think a very different perspective, and I think the kind of problems જે અત્યારે લોકોને સિરિયસ લાગી રહ્યા છે, it need patience also.
Lot of
કે you can't just take the pills and solve the problem.
Yeah, exactly.
Rather it would be great કે જ્યાં તમે right advisory પાસે પહોંચો, right treatments લો, અને then gradually you go
It's
into
a
the
journey.
solution.
It's a journey. It's not
And
a
I think the
destination.
new generation might be, I don't know, based on my experience, કે it's they just need very quick. એટલે જે અટેન્શન સ્પેન જે ઇન્સ્ટાગ્રામના લીધે બી જે ઓછો થયો છે ઇટ્સ વેરી પ્રેક્ટિકલી, તો હવે લોકોને એમ છે કે હું 2 વાર આઈસ થઈ જશે ને, એક વાર આઈસ હું આ કરીશ એટલે થઈ જશે ને, but you need that patience, be it the business or be it the solution of your problem as well.
Absolutely.
Okay, our team has come up with very good fun segment with you to discuss. Say glow up when you say when you want, you know, a smart move you made in a business or a clinic. And grow up is something where you feel it's a mistake from which you learn something.
Right.
So glow up or grow up, right? Okay, so hiring your first team member is glow up or grow up?
Glow up, definitely.
Right. Spending on high end equipments early on.
Absolute glow up.
Okay.
Absolutely, because people want quality at the right price,
Right.
and I don't really bother much about my price, so I just give them quality at the right price.
You did some research before that કે equipments ની જરૂર છે જ,
A lot of research.
Okay.
Lot of research, yes.
Wonderful. Saying yes to influencer collaborations.
It's somewhere in between glow up and grow up. I think because even, you know, as an influencer there is a lot of responsibility
They have.
and you need a genuine influencer. So if the influencer is genuine, it's a total glow up.
Right.
You know, so it depends a lot on the quality. Same. You know, now people also realize
nowadays they understood.
કેમ મૂકે છે.
વર્ષ પહેલા હજી I feel being in the industry, okay, મને આટલા લોકો જોઈએ છે, આ બઝ ઊભો થઈ જશે, but then really are they influencing people?
Yeah.
એટલે I'm sure you.
So collaborating with the right influencers is glow up, but
right.
yeah, you have to know the person.
Delegating business task.
Glow up.
Of course.
એના વગર તો કંઈ થાય જ નહીં.
Launching a new service you weren't fully convinced about.
I usually don't launch a service. I'm not. So first demo happens on me.
Okay.
Or my mom or my sister, who is going to give me 100% good feedback.
Okay.
And then if we feel and we see research papers, we do you know, proper clinical data validation. પછી જ કરીએ.
Wow. Being digitally active.
Glow up. Then એના વગર તો
ચાલે એમ નથી અત્યારે.
How do you reach people, right?
True.
And how do you give the advice? Like how do you
balancing medical precision with the art of aesthetics?
Yes.
And this is what actually we already thought of. It's of course from Bansari it would be a glow up. None of the answer would be into, you know, because the kind of vision you have, the kind of be the change you want to make it, it is going to be a very calculated risk only. You don't want to mess with the patient, or you don't want to.
Absolutely.
Great talking to you, Bansari.
No,
Bahut
thank you.
And I think this will inspire a lot to people who would be looking into this, and not just કે you know આ ફિલ્ડમાં બિઝનેસ કરવો હોય, આ ફિલ્ડમાં આવવું હોય, but the other business as well. કે અગર તમારા ઇન્ટેન્શન્સ અને તમારા એથિક્સ સાચા છે, તમારી પ્રેક્ટિસ સાચી છે, then of course the business is going to grow.
It is.
અને that's the right example we have in front of us.
No, thank you, Meet, for having me. It means a lot. You know, known you since a long time now, and always you know, thought of you as a very, very enterprising, lively,
thank you so much,
and lovely person at heart. So please keep it up. Please keep up the good work.
Sure.
That you are doing. I think you're doing a fab job. You and your entire team.
Yeah, thank you so much.
I think it's amazing. Please keep it up.
Thank you so much.